Feeding and eating disorders. Anorexia. Why might anorexia be at higher risk? Somebody with anorexia. Higher risk for suicide. It's never enough. Never good enough. This is about control or lack thereof, right? We know that this disorder is related to that. Okay? Think about what they do, what anorexics do to themselves. Some people look at it as they use more lethal means, possibly, because they already are putting themselves through trauma, hunger pains. Some people get sick. You feel sick when you don't eat, right? You get sick, you have hunger pains, you may be nauseated, and that's just after maybe a day or so. Imagine days and days and days of not eating, or even, causing yourself to vomit, self-induced vomiting. It's painful. It's painful to dry heave when you are nauseated and you vomit. It hurts your body to do that, right? And they're doing this on purpose to themselves over and over and over again. So some people think they get desensitized to pain. So they may do something a little bit more lethal, all right? Also, if you think about it, they're not making the best judgment, all right? They don't have the best thinking at all, right? They're not eating. Their brain is maybe the brain chemistry is changing. It might be more organic because they're not getting what they need for food, right? They may be dehydrated, not making the best decisions and choices, a little confusion there, maybe delirious. Some of them get very delusional. They look at themselves in the mirror and they see something completely different. A lot of that may be organic in that way. Does that make sense? People with anorexia, yes, definitely have a higher risk. Okay? What about bulimia nervosa? Why do you think they may have a higher risk? Anybody know anything about? Yes.
Like have a lot of self-loathing when they go through the binging.
Yes, self-loathing when they go through the binging. What were you going to say? Self-loathing, shame, guilt. A lot of shame and guilt comes with this particular eating disorder, okay? They usually self-induce vomiting in private, right? They get caught by maybe loved ones, a friend catches them in the bathroom. They're typically a regular body weight. We don't know that they have this disorder in that way. A lot of shame and guilt. They binge eat, okay? They do it in secret. A lot. So a lot of self-loathing that comes from that. So with the shame, the guilt, you may also see this with a depressive disorder diagnosis as well. Okay, just depending on how severe. But definitely at higher risk for suicide.